Hi everyone. In today's clip, I will talk a little bit about lipedema. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So lipedema is a chronic condition characterized by the abnormal accumulation of fat, primarily in the legs and sometimes at the arms, often causing pain, swelling, and easy bruising. It predominantly affects women and often is misdiagnosed as obesity or lymphedema. Lipedema is a disorder of the subcutaneous fat tissue, meaning the fat layer just underneath the skin. It's not the same as simple obesity, as the fat accumulation is often symmetrical, disproportionate to the rest of the body, and doesn't respond to typical weight loss and weight loss methods. Lipedema typically affects the legs and buttocks and sometimes the arms, but usually spares the hands and feet. Affected areas are often painful and tender to touch and may, as I mentioned, may bruise easily. Swelling, especially in the legs, can be a prominent symptom, and the skin may feel tight or heavy. Lipedema often appears or worsens around puberty, pregnancy, menopause, suggesting a role for female hormones. Lipedema is frequently misdiagnosed as obesity and lymphedema, as I mentioned, leading to delayed or inappropriate treatment. Now, the symptoms are things like swelling and pain in the legs and arms, a tendency to bruise easily, fatty tissue accumulation that doesn't respond to diet or exercise, disproportionate body shape with larger legs and a smaller upper body, feeling of heaviness or fullness in the affected limbs, nodules or lumps under the skin. Now, important points to remember are lipedema is a chronic condition, meaning it's a long-term and may require ongoing management. Conventional medicine does not have a cure for lipedema, but they use various treatments to help manage symptoms and improve quality of life. While not life-threatening, lipedema can significantly impact physical and emotional well-being, of course. This is precisely where orthomolecular therapy for lipedema comes in. The targeted administration of vitamins, trace minerals, or trace elements, and secondary plant substances is needed to slow down inflammatory processes, strengthen the tissue, and alleviate the symptoms. Frequently used nutrients for this are omega-3 fatty acids, EPA and DHA. This is often used in orthomolecular medicine as it has a strong anti-inflammatory effect. EFAs, or essential fatty acids, also promote the formation of specialized pro-resolving mediators like resolvins, which play a crucial role in resolution of inflammation and restoring tissues to healthy state after immune response, and mericins, which actively reduce inflammation, reduce pain, and stimulate tissue regeneration. However, if you are on blood thinners, be careful about EFAs or essential fatty acids because they also thin the blood. Among other things, these mediators influence TRP ion channels, and these are a large family of proteins that act as cellular sensors, detecting and responding to a wide range of stimuli, including temperature, mechanical stress, chemicals and chemical signals. They're crucial for various physiological processes like sensory perception of pain, taste, or vision, also cellular signaling, and more. In lipedema, around 80% of those affected suffer from pain. So this is quite important. General dosage is a daily intake of at least 1 gram of EPA plus DHA, which is recommended, initially up to even 2 grams a day if necessary in order to modulate inflammatory process and pain. Then we have vitamin D3 and plenty of K2. Vitamin D is considered immune modulatory and important for healthy adipose tissue metabolism, as with obesity, lipedema patients have often deficiency of vitamin D. In practice, 1,000 to 2,000 international units of vitamin D3 are used often daily, whereby high doses like 4,000 international units should be administered under medical supervision. Vitamin D has an inflammation regulating effect and promotes the normal function of the fat and immune system in the event of deficiency. In the event of deficiency, the tissue health is going to be deteriorating. So then we have vitamin C and polyphenols. Vitamin C or ascorbic acid has a double positive effect. As an antioxidant, it intercepts reactive oxygen radicals and hence reduces oxidative stress and inflammation. Vitamin C also supports collagen synthesis, which is important for connective tissue, capillary stability, and healing processes. This is relevant as the connective tissue is also affected in lipedema. General dosage, 3,000 to 4,000 milligram vitamin C a day is recommended in divided doses. Also, if you're not on vitamin C supplements already, start slow and build up. High doses are generally well tolerated. Polyphenols, secondary plant substances like from green tea, berries, olives, also have an antioxidant and partially anti-inflammatory effect. A diet rich in polyphenols, such as Mediterranean diet, can reduce low-grade inflammation. Studies have shown that certain polyphenols, like the ones from olive leaf or olive oil or curcumin, which comes from turmeric, are quite effective. General dosage is a daily intake of around 100 to 150 milligram of various polyphenols is recommended via diet and possibly extracts. In practical terms, this means, for example, regularly consuming berries, green tea, turmeric, olive oil, etc., or standardized extracts such as quercetin or turmeric preparations. In addition to the nutrients that I just mentioned, various vitamins and trace elements to be also considered for lipedema. Vitamin B12, for example, or cobalamin, supports nerve regeneration and function. I would recommend taking a B12 status holotranscobalamin or holo-TC, which is the active form of B12 that is bound to transcobalamin, a protein that transports it in the blood to cells to be used. It's considered a more sensitive indicator of vitamin B12 status than total serum vitamin B12 levels, as it represents the portion of B12 that is readily available for cellular uptake and function, and aiming for values in upper normal range. So general dosage, if needed, high doses like 1,000 to 2,000 micrograms a day, also used as B12 are used also in B12 as it's excreted in excess as water-soluble vitamin, because it's going to get rid of it if you don't use it, basically. So magnesium is another thing, is often taken by those that are impacted, for example, to relax muscles and relieve cramps. Magnesium supports muscle function and energy metabolism and could indirectly contribute to pain reduction. Because serum magnesium is often unreliable, whole blood magnesium is usually determined integratively. So general dosage, 300 to 400 milligram magnesium a day, magnesium citrate actually is typical, and especially if there is a deficiency or increased requirement found through tests that are being done. Selenium is also a cofactor of important antioxidant enzymes and supports the immune system. In a study of 198 lipedema patients, selenium deficiency was found to be strikingly common. So, general dosage of selenium, if supplementing, usually 50 to 100 micrograms a day. Please note, selenium should not be taken blindly in high doses, as overdose can have a toxic effect, hair loss, brittle nails, etc. This is why it is good to first do a test and find out if you're deficient. Then there is zinc. Zinc is involved in the regulation of the immune system and as an antioxidant. A serious zinc deficiency can intensify inflammatory responses or processes. Once again, this is better determined from whole blood, as around 80% of the body's zinc is bound to the blood cells. General dosage, usual supplementation is from 10 to 30 milligrams of zinc a day in the zinc citrate format if a deficiency has been identified. In general, omega-3 fatty acids, D3 and K2, polyphenols, and vitamin C are the most promising supplements for lipedema. Now, stay away from processed foods, sugar and sugar substitutes, simple sugars and sugar substitutes, and try to follow a clean diet with no hormone-treated meats or excess chemicals. Drink adequate amounts of clean water. Also consider lymphatic massages, as this is quite important. I do have a clip on lymphatic massage if you wish to check. Adequate rest and staying away from stress is also important, as stress can trigger and worsen the flare-ups. The therapy is complex, and I would definitely suggest for it to be customized by a healthcare provider once the tests are done to ensure proper dosage and efficacy. Hope this has been helpful. Like and follow for more. Be the light.